Hello friends, I am Dr.Arpana. I am a homeopathic consultant. Today we will know about the Kegel exercises or Kegels. Now Kegel exercise is a very good exercise for everyone. Today we will be discussing about the benefits of Kegels exercise or the Kegels for female. If you are new to my channel, do not forget to subscribe to the channel and hit on the bell icon so that you are always updated whenever I share any new video. You do not miss any of them. Now Kegel exercises, also known as Kegels, it is also present in the yogic practice. It is a kind of asana also, and this exercise is to strengthen the pelvic floor. Now what do we understand by the pelvic floor? So pelvic floor is the bottom of the pelvis and it is supporting all the important structures, and the pelvic floor is having certain openings like the urethral opening, the vaginal opening, the anal opening, and they are all present in the pelvic floor. So there are certain muscles which are present in this pelvic floor, and to strengthen up those muscles we have the Kegel exercises or the pelvic floor exercises to strengthen up the pelvic floor muscles. Now what is the importance of Kegels for a female? Now if a female is having repeated childbirth, or there is complicated delivery, or the female is perhaps overweight, obese, there is some kind of vaginal trauma, or even menopause, they all can actually make the pelvic floor weak, and the symptoms of a weak pelvic floor will be there will be escape of few drops of urine while maybe coughing or sneezing or laughing. Sometimes there will be a feeling as if something is coming down, there is some dragging down sensation. So which shows that there is possibility of pelvic floor weakness. Now to deal with this, we have the very important Kegels or the Kegel exercises, which is for strengthening up of the pelvic floor muscles. Now you know about the symptoms that a weak pelvic floor may give rise to escape of urine or incontinence of urine, or sometimes even incontinence of the bowel movement. The female is trying not to pass the gas, but the gas will escape. She is trying to hold the urine while laughing, but still few drops of urine will come out while laughing or sneezing or on coughing. So these are the indications of a weak pelvic floor muscle. So to understand this, you can imagine that you have a bag which is perhaps overloaded. So what will happen? The bottom of the bag will become weak. It will tend to tear. The same is happening with the body. So it's a sac, and the floor of the sac or the pelvic floor will become weak by overweight, by injury, by complicated childbirth, by hormonal changes or menopause, or if there is some kind of constant pressure in the abdominal area. Perhaps if someone is having chronic constipation, that can also put pressure in the pelvic area or in the pelvic floor muscles. So now how to do the exercise? So for doing the exercise, the bladder should always be empty. You should not do the exercise with a full bladder. So the pelvic floor exercise is done by squeezing the openings of the pelvic floor and trying to pull them up, or trying to pull them upwards towards the navel. So what you have to do, you have to basically try to identify the muscles present around the urethra, the vaginal muscles and the anal muscles, and you have to kind of squeeze the muscles and try to pull them upwards towards the maybe towards the center of the body, towards the navel, towards the umbilicus. So you have to first of all identify the muscles, squeeze them and pull them upwards, and you have to keep the contraction for maybe 3 seconds initially, and then you can extend it to up to 5 seconds or even 10 seconds, and then you have to just release, relax, take a deep breath and again repeat the sets or repeat the exercise. Now what will happen? This will kind of help in strengthening up of the pelvic floor muscles, which in turn will ensure that the urinary incontinence or perhaps the incontinence of stools. So you can do this exercise to strengthen up your pelvic floor muscle. So this is all about Kegels or the pelvic floor exercises. It is very easy to do. You can do it anywhere. You can do it sitting. You can do it sitting at your workplace. You can do it lying or maybe standing. So you can basically do it at any time of the day. The only condition is the bladder should not be full. This exercise will help in strengthening up of the pelvis or the pelvic floor and will save you from the urinary incontinence which happens with age in case of females. We also have some homeopathic medicines for urinary incontinence, especially in case of a female, menopausal age. Sepia is a very good medicine. We have medicines like Causticum and other medicines also, but the medicines are always based on the symptoms, on the cause. And this exercise anybody can do, and this is very important for female of any age group. It is not important, or it is not that if you are having the urinary incontinence then you will start doing the Kegels. You can start doing it right away from a young age only, so that you do not end up in having the problem later on or with old age. I hope you have liked the information about Kegels or the Kegel exercise. Do not forget to share the video with your friend and your family, especially with your female friend, with your mother, with your aunt, so that they can also get benefited from this video. If you wish to book an appointment with me, you can go to my website Dr.Arpana.com. You can also send a message through WhatsApp in our office WhatsApp number. All the details are already given to you in the description box. Always remember, when a healthy mind and a healthy body resides together, diseases disappear. Thank you so much for watching.